Scott Cypher here, Dr. Cypher. I'm back in a minute, and we're going to talk about the cause of most pain. We're talking about the different stresses. You know, many books and many gurus have talked about this over and over about how there's different stresses in life. Everyone is more susceptible than others. Like, there are some people who are just more susceptible to emotional stress. They're maybe a little more sensitive. There are the people who are more involved with, they're more sensitive to physical stress. Maybe they've had physical injuries, you know. Maybe you're an athlete, maybe you had a car crash, or maybe you had repetitive stress like this poor fellow down here who's sitting pecking at the computer all day, all right? And then there are others who are more affected by the various chemicals. That's not necessarily a drug. It could be a toxin in the environment. It could be a food allergy, delayed or otherwise hypersensitivity. But all these stresses, I'm just pointing this out, this is like the sweet spot. This is the patient who comes into my office. Usually they wait about 7 to 10 years before the initial trigger or injuring factor. And that causes, so all these stresses multiply and they form like a perfect storm, so to speak. It's kind of interesting, one of my patients literally won the lottery. We had this discussion, and you know, the one thing he said, are you happy? And he goes, you know what, Scott, I could win one lottery or 300 lotteries. It doesn't matter. The most important thing is your time and your health. And that's, you think about it, money comes and goes, but the one thing that you don't have enough of, because it's constantly leaving you as I speak, is your time. So your time and your health is literally your wealth. So today I'm going to be talking about some examples of what causes physical pain in the spine, and then after that I'm going to talk about some physiologic debridement, different ways that we can manage that. So it's been said that, you know, you can check Google this. This is called upper cross and lower cross syndrome, but this has been going on for a long time. Notice this is like someone who's kind of hunched over, and there are 3 gears. One is going one way, one is going the other way, the other is going the other way. So they're all interconnected, and this represents like the neck, kind of the middle back, and the lumbopelvis. So if you can see here, imagine if I put a little piece of plastic and I put it right in that gear, like that, and it got kind of stuck. Okay, so, you know, different people have different strategies like that. One of the strategies would be take this pill. This is a non-steroidal anti-inflammatory, by the way, or maybe a muscle relaxer or a painkiller. Muscle relaxers really don't relax the muscle, they prevent you from feeling it. And there can be some advantages and definite disadvantages with that, because you become more distanced from your own nervous system, which isn't always a good thing. But so let's just take this as a non-steroidal anti-inflammatory, which goes to your kidney and liver, and it can hurt if taking over a long period of time. And you put this non-steroidal anti-inflammatory into the mouth of this patient, hoping that it's going to dislodge this straw. Okay, so you can see the failure of logic. It can't. It never will. This is a mechanical problem. This is a drug, you know. And besides, even if this is developing heat with that gear that's seizing up, how does the drug know to go to just that one joint? It can't, and it never will. This is more of a mechanical. So the kind of a chiropractic perspective would be, okay, something's in there. Let's take you know, the straw, and this kind of, maybe we can hopefully it'll blow the critter out of there, you know. Or we can take a little piece of floss, and you can floss it out. Okay, that's basically what we do with the chiropractic adjustment. If something, you know, I'll reference this model. It's a really good model. If something is stuck, instead of just giving a drug and hoping, you know, don't call, you know, if you want a second opinion, just call me in the morning. No, it's better to just do something directly and treat the cause. So this is moving well. Most people would agree. So there's a problem with the red one. It's stuck. It's not moving. So, you know, whether you use a little bit of spray, or, you know, with a little chiropractic adjustment, or even some WD-40 if you have to, the whole idea is to get it moving. So life is motion. If you're moving, you're living. And there's less pain when you move. We know that now. So now, after the chiropractic adjustment, see, now it's moving. See, it's moving. So this is like a before, right? And this is after chiropractic care. You know, the whole idea would be to treat it mechanically rather than with a medication. We also, in assessing that, the patients come in, is what we find actually, we start our exam from the feet up too. What happens is a lot of people have distorted feet. One foot is more pronated or rolled in or out than the other. And so if you treat the spine, but unless you also address the cause, and a lot of times this is a simple custom orthotic that we put in. It gives you years of life and life to years to help level out the pelvis so this man is less crooked in the first place, Okay. The injury, right, it can be like what I call micro injury, right? Micro injury or macro injury, meaning macro, I think of like a Mack truck, right? Someone who rear ends you and you're at a competitive disadvantage, so they get a major injury or a sports injury, or a car crash, whatever. Micro is more subtle. That's like computer stress. Computer stress. You're like this poor individual sitting hunched over at their computer day in and day out, and it's like a little. It's like a little hammer. You're like, and eventually it starts developing cracks. And so this is a sledgehammer, and that's the ball peen hammer. But it doesn't really. The body it doesn't distinguish. An injury is an injury, and that causes swelling. So swelling equals pain, right? Equals pain. And so if your traditional medical approach, what's called usual medical approach, would again be to give the anti-inflammatory pill. But our approach is a little bit different because we're actually doing something mechanically. We're trying to flush. Basically, some of the therapies that we use, I'll show you this one cold laser in a minute. What we're doing is we're kind of flushing the radiator, so to speak. Most people who have this injury, again, this is usually about 7 to 10 years prior by the time they come in and they actually manifest on an x-ray or an MRI. You can see the damage, and you can tell it was like with the chronology, like 7 to 10 years earlier that they had the actual injury. And then it harbors and it manifests as pain because the radiator overheats. So if your radiator is overheating in your car, it's not a good idea to ignore the check engine light. You want to pull the car off the side of the road if it's showing you it's hot, because why? If you keep driving the car, you can cause major damage to the motor itself. So the whole idea, what we do would be, the body is kind of designed to kind of manage the swelling, and some people say you don't want to actually stop the swelling. If anything, you want to facilitate the swelling. And a lot of people say that you do that with motion. Motion, early and active motion. But most people, their swelling doesn't have a chance to go into these different phases that I'm going to talk about because they keep pounding at it. They keep pecking away at the computer. They keep injuring themselves, and so the swelling. The job of the swelling is to alert the nerves in your CPU, your brain, that something needs repaired, and then for the tissue repair. So the injury comes first, then the swelling, and then the repair, and then what's called the remodeling. Problem is, most people never get a chance to go through that, and these things become incomplete. And so the default to this incompletion and this incompletion is that it goes into what's called chronic pain. It's not really completely resolved. Or sometimes they have a little repair, but it's not remodeled, And this chronic inflammation, is again what we were talking about before is mechanically driven. So the hands-on chiropractic adjustment that we perform actually kind of reboots to more of an acute swelling so that it can go through this repair process. So, the old-time chiropractic doctors used to say, well, we remove nerve pressure or nerve interference. And the truth is we've known this since the early 2000s, that we actually create just a little bit of irritation so the body can go through this repair cycle, okay? Now, the final thing I want to talk about is one modality, one therapy that we have here. It's it's a new development. It's called cold laser. So what it does is it helps to flush out some of the radiator, and this is what it is. This is called a cold laser. It's a laser code. Works nicely. Does not hurt. To just a big picture to differentiate this from a hot laser, from cold laser. Remember, a hot laser, that's the one that they use in surgery, and they cut the tissue and it's hot, and but this is not a hot laser. This is a cold laser, so there's no side effects. Studies show that lasers like this can help with back pain, knee pain, any kind of neuropathy, nerve problem, arthritis, bursitis, any kind of sprains and strains is very helpful. carpal tunnel, shin splints, tendonitis, and many more. It's a nice thing because it doesn't have any side effects. It's natural, and it just helps increase the energy, at a mitochondrial level, at a cellular level. It's called photobiomodulation. Is a technical word. It's really condensed light, laser light. And so what it does, like here's an example of an injury from an infrared camera, and I borrow this from Dr. Nelson Marquina. And he uses, of course, he's the guru in our country for this. This is someone who just had a really acute injury. It was, and what he did was he took the laser, and this happens to be an elbow, and he treated it with the laser, and you can see the nice resolution of the inflammation. This is like the before and the after, and so you don't have to be a high-powered athlete to get the benefit of some of these therapies. So that's all I want to talk about today. And then I'll be back in a minute.